Spasticity is a condition where the hands and the legs, or either the hands or the legs, become stiff, as a result of which a person cannot walk fast, cannot run easily, keeps tripping over things, or in the worst case scenario, spasticity can be so severe that the legs can hardly be moved. When spasticity affects the upper limbs, the person cannot use their hands to button their shirts, break their chapatis, eat food, do any of the routine activities that a person has to do to either carry on their day-to-day activities or their job. So this can be quite a serious problem. When spasticity affects little children, it's most often the result of cerebral palsy, where there's some kind of trauma or damage to the brain around the period of birth. And this can lead to quite significant stiffness in both hands and legs. In adults, this very often happens after conditions like spinal injuries, or after strokes, or sometimes even after things like tumors which affect the spinal cord or the brain. Now, any person who has spasticity can be managed in three ways. Either you can have medicines which are quite effective when the spasticity is relatively low grade, or they can have what is called a baclofen pump inserted. Baclofen is one of the drugs which can be given as tablets, but sometimes when that doesn't work, you need to give it as an injection directly into the spinal cord, in the region of the spinal cord. So what's done is a thin tube, plastic tube is inserted between the bones of the spine at the back, and it's connected to a pump which is under the skin on the abdomen. And this pump constantly injects little by little small amounts of baclofen around the spinal cord, and this helps to decrease the spasticity or the tightness in the particular area of the body. Finally, there are other ways to treat this, which are surgical. So you can have what is called a selective dorsal rhizotomy, where some of the nerves on the back on the spine are cut selectively so that the stiffness in the lower limb decreases. Surprisingly, such selective dorsal rhizotomy can also improve the upper limb. So, and most often in correctly selected patients, these kind of procedures are very effective, and they are once again able to lead a relatively normal life, or at least reduce spasticity sufficient for the caregivers to move their limbs and take care of them properly.